My name is Helen Hirst and I'm the Chief Officer of Airedale, Wharfedale and Craven, Bradford City and Bradford District's clinical commissioning groups. I'm here to talk to you about a proposal to create a new clinical commissioning group to serve the people of Bradford District and Craven. This would replace the current 3 clinical commissioning groups that are there at the moment. A clinical commissioning group, or a CCG for short, is a statutory NHS body that's responsible for planning and paying for local health services. They were created in the Health Act of 2012 and in Bradford District and Craven we have 3. The most important thing about this proposal is what it's not. This is not about changing our local health services, it's not about changing our hospitals or our GP practices or our community services or any of those things that people access on a day-to-day basis. When we were created back in 2012, Bradford City and Bradford District CCGs agreed to share an accountable officer and many of their senior management functions. We were then joined by Airedale, Wharfedale and Craven CCG in 2016, and since that time we have worked as one management team, a lot of shared governance arrangements, a lot of shared committees, and so it feels like the sort of next natural step to create a single CCG. When we look back at some of the papers we prepared in 2016 when we came together as the 3, we had predicted then that probably by 2021 we would be looking to create a single CCG. However, NHS England have introduced some management cost reductions that have required us to think about that step now. These management cost reductions amount to around £2.5 million. By creating a single CCG, we will save £1 million of that £2.5 million saving in one go. The £1 million savings will come from the creation of one governing body, one clinical board, one set of annual accounts, one set of audit fees, so mainly what you might consider to be bureaucratic changes. If we don't create a single CCG and are able to make those types of savings, then we'll have no choice than to look at some of our staff costs and some of our non-administrative costs that would take us towards the £2.5 million that we need. Creating one CCG will also save us time. It will be much more efficient, not just for the staff who work in the CCG, but also for our partners and other stakeholders who will only then have to engage with one organisation. I know people's main concern will be that we'll lose our local focus. So having 3 CCGs that sort of sit across the whole of the Bradford District and Craven means that we've got some really strong personal local relationships with communities. That's a concern to me too, and I want to ensure that in the design of the new CCG that we really build that feedback in and ensure that that doesn't happen. You'll also be aware that over the last couple of years we've created 13 community partnerships, and the changes to the CCG should be seen in this context. Those community partnerships work at a level of neighbourhoods and people who live in those neighbourhoods. And that's the important thing with the changes that we're talking about here, is those things are not affected. Those partnerships will get stronger and will start and become the local voice of our commissioning services as well as many of our provided services. The other concern that I've heard is that the resources we have will not necessarily be deployed in the areas of need. And people are concerned that some of the health inequalities that we've got across this district will be exacerbated because the money won't follow the need. So again, in the establishment of a new CCG, we need to be really clear how the resources are going to work. We have already started analysing how we spend our healthcare resources by 13 community partnerships, and the intention is that we'll continue with that arrangement so that it's very clear to see where the resources are spent and how it's affecting the health care and outcomes for the people in those communities. So the 3 CCGs are made up of their member practices, and ultimately it is their decision whether we create this new CCG. Your feedback will be fed directly to them as part of their decision-making process, which expects to conclude by the end of June. If the proposal is accepted, we would have to submit an application to NHS England, and then we would expect to be operational as a new CCG from the beginning of April 2020. We would really like to hear from you. We'd like to hear your views on this proposal, whether you think it's a good idea, whether you think there's another way we should be looking at this. I want to reassure you that whatever the outcome of this engagement, whatever decisions we end up taking, we're absolutely committed to serving the people of Bradford District and Craven in the absolute best way we can. I would really urge you to look at some of the developments we've got happening through health and care partnerships and through our community partnerships, because that's where we can really get involved and really make a difference to the people.